The podcast that brings together rare disease patients, families, and advocates to share their stories, educate medical professionals and the public, and explore clinical trials and resources needed for the 95% of rare conditions without FDA-approved treatments. I'm your host, Joanna, and today we have an important episode with our guest, Briana. Briana's son has been diagnosed with Maple Syrup Urine Disease, or MSUD, and chronic intestinal pseudo obstruction. He is currently preparing for this is a dual liver and intestine transplant. Both MSUD and chronic intestinal pseudo obstruction are part of the newborn screening, are actually part of the Medical Nutrtion Equity Act. They're both covered by it, which would provide medical foods, formula, and vitamins to those who need them nationwide. Currently, there is it varies state to state. The bill has been reintroduced into Congress and is awaiting a Senate Republican to reintroduce on Senate side. This is also September is also Newborn Screening Awareness Month, and so we will be talking a little bit about that too. Since maple syrup urine disease is part of the newborn screening. Which would this month is before we dive in, I'd like to remind everyone that the information in this discussed in the podcast is not medical advice. Please consult with a healthcare professional before making any changes to your healthcare regimen. And as always, please keep the comments free from political discussion. Our goal is to focus on issues that impact the rare disease community. Thank you for joining us.
Oh, no problem.
So, Briana, can you tell us about your son's diagnosis with maple syrup urine disease and chronic intestinal pseudo obstruction? What did how did you first realize something was wrong?
Well, when he was born, after the first time he was fed, he was puking. Like he was vomiting constantly. And we went to his pediatrician. We had talked to the labor and delivery nurses when we were still in the hospital, and they were just telling me pretty much, hey, it's normal for, babies to spit up as newborns because they're learning how to eat, they're learning how to do this. And it's like, well, I've had 5 kids, and this is different. This was seemingly different to me. So I had to go through WIC here to get a referral to a gastroenterologist doctor. I had to get a referral to one of them. And we've seen him for a while, and I just had explained to him that he pukes, and he wasn't gaining weight. He was almost 4 months old, and he was 9 pounds. And to me, it's like that's not normal. At this point, he should be at least a good 15. So then they ended up placing the NG tube. So we had that, and then we swapped to a new doctor for gastroenterology down in Toledo, and he ran many tests on him. He thought maybe that he had what they call Hirschsprung's disease. Turns out he didn't have it, which is great. But he hadn't pooped in a year. Mind you, he did poop out the meconium as a newborn, but after that, it went from being like once every couple of weeks to once a month, and then we went months and he didn't go to the bathroom. So his GI doctor in Toledo sent us a referral to Columbus, which is Nationwide Children's, to see Dr. Carla Voss, motility doctor. She's a great lady. And I had explained to her that, hey, at this point he's been, he was about 15 pounds. He's been 15 pounds for probably 4 months. Still isn't pooping, hasn't pooped for almost a year. And she was like, well, I'm going to admit you. We're going to do some diagnostic testing. And it just so happened that when they were doing their first set of labs, I think we were there maybe 3 or 4 days, and they took some labs to check on everything, and his amino acids were high. And they were like, okay, well, this isn't normal. It looks like he has maple syrup urine disease. So, me being me, it's like, I've never heard of that. So it's like, what is that? But they were like, well, we want to redo the blood work just to be sure. But they pulled him off of his formula, had him on IV fluids, had him on the sugar bag. And then, so they reran them. They were still high. So then that's when we got in contact with the metabolic specialist or genetics team there in Columbus. And he had continued to run labs, decided that we were going to swap his regular Elecare, because at the time he was on Elecare Junior by itself. And then he swapped it to MSD complex and Pro Free, and then put the Elecare along with it to kind of find an equal amount for all of these to keep his amino acids not too low, but like in the normal range. And that can range from, I think, some of them are between 30 and 160, and others normal can be as high as the 300s. But anything above that, as far as his leucine, his isoleucine, and his alloisoleucine, have to be at a certain number. Like his alloisoleucine has to be below 6. So if it's anything above that, it's considered abnormal. And I think juniors got up to 30, like 32. So that was concerning. And then his leucine is between 60 and 120, and his were well past. They were like 390. And then his leucine was about the same. Their numbers are kind of similar with one another, but the ones that really matter are his leucine and his isoleucine. Those are the major ones that you have to keep at bay or in normal, because if those get too high, that can actually cause a metabolic crisis that can either cause coma or death in children that have this. And so the fact that he went so long without anybody knowing he had it was kind of mind blowing. But they chalk it up to the fact he just puked so much starting out for when he was, from the time he was born up until this point, because he wasn't able to keep all of the protein in that he was taking in, because a lot of it that he was taking in, it was coming back out. So it didn't have time for his body to try to break it down or to do any of that. So they think that that's why his numbers didn't get too high. But a lot of kids that have maple syrup urine disease, their numbers get to be into the thousands. So it varies, I guess, from kid to kid. Now my son doesn't carry the gene. My son doesn't have the gene for maple syrup urine disease, which makes his extra rare. On top of it already being rare. And me and my husband, we don't carry the gene for it. So yeah, he doesn't carry the gene for MSUD, and he is one of, I think, 6 other cases in the US that a kid has MSUD but doesn't carry the gene.
I didn't even think that was possible.
Me neither, but here we are. So yeah, he
wasn't diagnosed by newborn screening.
Say that again.
So he wasn't diagnosed by newborn screening?
No, actually, and it's actually a law in the state of Ohio that they be screened for maple syrup urine disease, and that might be everywhere. I'm not really sure. But it's required by law for them to be tested as a newborn. But my son didn't have an MSUD ran on his newborn screen. Now I don't know why that is, and I don't know that my other kids were. I haven't looked back on theirs. But yeah, he wasn't. His amino acids were never tested in his newborn screen. They tested for his sugar and then for, certain diseases and this, that, and the other, but they didn't run a screen for MSUD, which we've seen as a red flag, because it's like, well, it's mandatory for this test to be done. And we've shared that information with his metabolic team and his motility team and everybody else that he has had to see concerning his maple syrup urine disease.
Let's see. How did okay, so that one about newborn screening isn't going to play in, but see, how did newborn screening play a role in diagnosing? Okay, so he wasn't diagnosed by newborn screening. So how did your experience with this? How long did it take for doctors to properly diagnose chronic intestinal pseudo obstruction, and what was the journey like?
Okay, so that goes back to his motility doctor, Carla Valls. When she admitted him, she wanted to run what they call a manometry procedure, which is where they took out his G tube that he had at the time. They took it out and they put these sensors down into his belly hole, and then they put one up his butt. And what they did is they just watched how everything was working, like if his stomach and his liver and his intestines were contracting and doing what they were supposed to do. And so for a while, his stomach and his liver were doing what they needed to do, or not his liver, but his colon. I'm sorry. I am so sorry. Talking about a different thing. His colon. So his colon and his stomach were doing what they were supposed to do, but it caused him a lot of pain. And he was screaming, like the worst thing in the world just happened to him. And so then she gave him a medication that was supposed to stimulate the organs to do the contracting and all that stuff. And we got no response from his small intestine, which wasn't working to begin with. Like, it wasn't doing anything to begin with. So she gives that first med to stimulate it, still nothing. But it made the colon and the stomach do what they needed to do. So she waited, a couple hours, gave him this second medication to stimulate, still nothing. We got nothing from the small intestine. Everything else, though, was working pretty well. And then we tried a 3-ounce bolus feed. Now those can be ran at a multitude of speed. You can either, hold them low and it'll take it over a course of 30 minutes, or you can hold it high and it'll be gone in 5 seconds. It just really depends on what your cup of tea is. So we did the 30-minute. So we gave it to him incredibly slow. And that stimulated his small intestine to do something, but not much. And the little bit that it was doing, it was sending everything back to his stomach. So he is 90% paralyzed small intestine and 10%, well, I do something, but I don't do the right thing. Now, when it comes to the pediatric pseudo obstruction, that doesn't necessarily mean that there is a present obstruction. That could mean many things, like the big intestine just doesn't do what it's supposed to do, or is acting as an obstruction, which was Junior's case, but with his colon. So when his intestine, things were coming through it, because the colon was getting mixed signals from the small intestine, and the small intestine was trying to send it back the other way. The colon was acting as a obstruction. It was stopping everything. So it was either stuck there. At some point, it would just be sent back to the way it came, in a sense. So it's really complicated. But this procedure took about 8 hours. And then after she came to talk to me, she told me that he had pediatric intestinal pseudo obstruction, or PIPO, and that he needed a surgery to get what they call an ileostomy bag. Now, it's almost the same as a colostomy bag, but they are different. The ileostomy bag comes off of the small intestine. They just pull a piece of it up and, make it like they would a colostomy bag in a sense, but different. So he has one of those. And then she ended up having to swap his G tube to a GJ tube. So he gets fed through the small intestine as well at this point. But he also, this disease requires a lot of pain management. He is on gabapentin around the clock. He is on what they call Levsin. He's on that around the clock. He takes a motility med that's supposed to force his intestines to do what they're supposed to do. He is also on sodium citrate because with this disease, it also causes you to deplete the sodium that your body requires to work. So he is on that. He has to be on a multivitamin every day. He has to be on of course, his thiamine for his MSUD. So he has to be on all that stuff. And so he's just, everything he's got going on is a lot. I mean, from his ostomy stuff to his medication list. And so, yeah, it's just, there's a lot that comes with it. Honestly, I wouldn't wish it on anybody. Like the diseases that he has and with them together makes them both worse with each other than they would be if he just had one or the other.
What does what does your daily life look like for you as a caregiver? And what are some of the biggest challenges you face managing your son's condition?
One of them I would have to say the biggest problem that I have, because he's 17 months old and he has always been a grabber. So my biggest issue with everything and the biggest challenge I have is probably keeping him from pulling his ostomy bag off. You would not believe the mornings that I get up and there's just poop everywhere because he's pulled it off or he's rubbed it the wrong way or the tops came off so I would have to say that's the biggest challenge with it. Because with a kid his age, it's hard to keep him from doing certain things. But our daily life, so he wakes up in the morning. It's about 8 o'clock, and I have to get his pump off the charger and fill up his pump bag, and then I have to run the milk through the tubing. And then I hook him up. He gets his meds. Then we hook him up to his milk. And then I spend about 20 minutes mixing new milk for the later half of the day and the beginning of the next morning. And then, we have to, of course, empty his ostomy bag. And we only change it every 3 days. So every 3 days he gets a bath. We take it off, we get a bath, and all that stuff. And then we put a new one on. And that, and it doesn't always work. The days we change it or when he pulls it off, I could put a fresh one on and get him all fixed up. And within a couple hours, I have to put another one on. It just depends on how his skin is reacting. Because it does cause a lot of irritation. So we use a lot of a powder he has medicated powder and regular that we have to put on there underneath the wafer. It also helps hold the wafer on. But it also keeps his skin from getting really, really irritated. And then we usually, we have therapy. He has to have therapy. And we have so many appointments throughout the month. We're probably in Columbus more than half the month with motility and genetics and colorectal reconstruction team. And now we're adding the transplant team and all of that stuff, but that's in Cincinnati. So I guess a little bit of change of scenery because we were stuck in Columbus for 3 months between April and the end of June. And that's when we found out he had the pediatric intestinal pseudo obstruction and the MSUD. And his geneticist, Dr. William Burns, great guy, really. But he's a little back and forth with a lot of things. Love the guy, don't get me wrong, but So we're always swapping something like that. Like his formula mix can change, his thiamine dose can change, his pain medication doses can change because some medications will actually affect the amino acids. So some medications he can't use, and some of them that he has to use have to be a very low dose because of certain things in it that trigger the amino acids to go up. So it's a lot, but I mean we get through it because we also have 4 other kids. So it's between dropping kids off at school, picking kids up, and everything else in between, we make it work.
Yeah. So a little bit of technical stuff, but they just want to clarify that when you're talking about milk, you mean formula, and so it's a lot of people.
His formula.
Yeah.
Sorry. Yeah.
Yeah.
Yeah, his formula. Yeah.
So the formula actually provides all the vitamins, I mean all the amino acids except for the ones that we can't have. So I have a different metabolic condition. I have homocystinuria, so I'm familiar with the formulas. And I know that a lot of people do call it milk.
That's a habit.
Yeah. So there are other things that they're called also, but but that's a big one. See, I pretty much call a spade and call it amino acid drink. That's
Hey,
it's
a good way to put it. Amino acid
yep.
drink. That's a good way to put it.
Because people don't understand protein drinks either. They will think it's whole protein and test for whole protein, and so you kind of got to break it down a little bit more than that. How has your son's diet been impacted by both maple syrup urine disease and chronic intestinal pseudo obstruction? And how do you manage his nutritional needs? I'm going a little into that.
Well, as far as his diet goes, the only thing that really changed was the type of formula we were using. We are still using some of the Elecare Junior, but as far as his diet in a whole goes, nothing really changed because he's been tube fed since he was about 3.5 months old. So that's not really changed a whole lot. Like I said, apart from adding in the MSD complex and the pro-free for the MSUD. Now, as far as his bowel obstruction, I don't think it's really changed his diet any, because he didn't take anything by mouth before we knew he had it, and he doesn't now. So it's not like he's not like most kids that do, because most kids that have the obstruction have to be set on a certain diet because their intestine doesn't work right. So you have to eat certain things, or like as far as texture, like instead of eating solid things, maybe some purees. Mommy, I'm busy. Maybe get some purees, or stuff like that. But there's not really a change for him at the moment, anyway.
Yeah. So, does he eat any solid foods, or is it?
Say that again. I'm sorry.
Does he eat any solid foods?
No, not really. But he's really not allowed to either. Now he gets the little meltable puffs that you can buy for babies. He gets those once in a blue moon. But he's not really allowed to have anything by mouth. One, because we don't know how his amino acids are going to react, because even with being on his metabolic formula and being on a certain regimen for that, there have been times where we've gotten labs done and his amino acids were sky high, even though he's on the thiamine and he's on the metabolic formula. And then there's times where they've done nothing to tweak it and they're normal or they're too low. So it's just really it'd be really complicated to find him something that he could have that had no protein, that he's able to actually eat, because he's not used to food by mouth. So I would have to start him on purees. So it'd just be really hard to find protein free stuff like that, because I don't know if they make protein free, but I could be wrong. I haven't really looked into it because I haven't had the need. Yeah, so as far as his diet goes, nothing's really changed because there wasn't really much to have to alter, I guess, when we discovered he had these issues.
So how old is he now?
17 months.
Oh, he's still pretty young. Can you share any experiences of navigating the healthcare system, particularly with specialists and hospitals or insurance? This is pretty big because I know that most medical foods, at least, and also formula, I think, are both billed under durable medical equipment. And so it gets a little confusing, I know, for some.
Yeah. Well, as far as getting the supplies he's needed for everything, I've actually had no problem with his insurance, which was kind of surprising because I really expected there to be some kind of issue. The only issue I've had with his insurance is one of the medications that he needed when we got swapped to a new motility med, and I would tell you what it was, but after life me cannot remember right at the moment for some reason. But we had a problem with that, and then we had a problem getting his Levsin approved. We had to send in a prior authorization. He needed some crap like that, and that took a minute. But apart from that, I haven't really had an issue with his insurance. Now, as far as navigating the hospital scene, and especially for long periods of time and dealing with all these different people, my advice is if it feels wrong, it probably is. If your gut tells you something differently than what you're being told, it's probably right, and you need to go with it. And because it took me a long time to learn that. We were there for 3 months, and I probably dealt with the unsettling feeling for a month and a half, and then I finally was like, look, no, this is not right. This doesn't make sense. So the best thing I can really say is advocate hard, like, for your kid, because you're pretty much all they have. And if you're not advocating for them, then who is? Because most of these kids can't do it themselves. And if there's anything I've learned about some doctors in Columbus, and I'm not going to name any of them because there's not really, I mean, there is specific ones, but not really. Some of them, you're like, dude, like, how, I don't know how you got a degree, like, because I heard some of the most ignorant things come from some of these specialists that are supposed to be smarter than me, and they're saying things, and it's like, that doesn't make sense, you know. So it is very emotionally and mentally draining when you're not getting where you want to be or where you think that your child should be, especially if you don't feel heard. Being heard is the biggest thing that I can make about the hospital scene and dealing with all these specialists. Because while, yes, they have college degrees, they know this, they know that, nobody knows your child better than you at the end of the day. Yeah, they can tell you what their test said, they can tell you what they think, they can tell you what some other kid did so many years ago, but at the end of the day, nobody knows your kid better than you. And if something doesn't feel right, or what they're doing doesn't seem like it's helpful, or if it's something that you're not comfortable with, or if it's causing, some discomfort, like with my son, if it's causing some discomfort, you have to speak on it. That is, you need to advocate. That is the biggest thing. Is just because somebody says, well, I don't think this, okay, well, it doesn't matter what you think, because I know my son, and if I say, hey, this is a problem, like, because he was, even with the gabapentin, that's a nerve blocker. Even with that, he was still in agony most of the time. He did nothing but cry. And I told his motility doctor time and time again, it's like, look, this is not a life for somebody. He's miserable. He needs something to go with this gabapentin so he can feel comfortable, because he's not. And I told her and told her and told her, and I think she finally understood. It's like, look, this is going to be a conversation every time I'm here. Like, giving him this transplant is going to be a conversation every time I'm in here, because the type of life that my son has right now is not a life that I would wish on anybody, because he's miserable. He's miserable most of the time. He can't enjoy simple things in life. He can't the only reason why he can crawl around and do little things is because, I ended up buying him a vest off of Amazon so his backpack would fit. So that way he could, crawl around and play without pulling his ostomy off, because that was a big problem for a while. And they're talking about putting him on the PICC line. So, we're going to have that, and it's going to get even worse, where he's just not going to be able to do anything, because with the PICC line, you don't get to go outside. You don't get to, you don't get to do these normal things that kids your age do.
Yeah.
And that's not a life for somebody. That's not a life for an adult, much less an infant, or a toddler.
Mm-hmm.
So I've advocated really hard since April. It's like, hey, look, if you're telling me that, these transplants can cure him of his problems, or at least make them better, make him feel better, and stuff like that. It's like, hey, at the end of the day, what he's going to gain from it outweighs the risk to it. I mean, but that's just my opinion.
Yeah, there is a possibility it can be a cure for maple syrup urine disease, at least.
Yeah, and it would be for him because he doesn't carry the gene. But
Right.
as far as the pseudo obstruction, it would get rid of that. He would have a set that was doing what it was supposed to do. He'd be able to poop out of his butt like a normal 2-year-old.
Yeah.
He'd be able to eat whatever he wanted. He'd be able to actually start learning to eat table food. He could come off his tube.
Mm-hmm.
There's just so much that comes with all of that, and they're like, well, yeah, it comes with this risk too. You're right, it does. But at least I know that at the end of the day, when the year is up after he has surgery, he's coming off all this. He's coming off his ostomy bag. He's coming off his metabolic formula. He's coming off the PICC. He's coming off the fluid. All that's going to disappear. And then
Yeah.
he's going to be himself. He's going to have his GJ tube for a while, of course, until he can eat and gain and maintain weight on his own, eating by mouth.
Mm-hmm.
That's a given, and that's fine. But that doesn't tie him down as much as everything else. And he won't need pain medication around the clock,
Yeah.
after the fact. So what he's gaining for it, from it, so outweighs the downside. So my biggest thing is, if it don't feel right, it's not right. If your gut says, hey, listen to it. Advocate. Avocation is the biggest thing, especially being in the hospital setting for months at a time.
Mm-hmm.
Because they will run you down and make you feel this way and that way, and you've just got to be. Avocation is the biggest thing.
Mm-hmm.
That's a big thing for me.
So, liver transplants are known to cure maple syrup urine diseases, we just mentioned. Can you share what led to the decision for your son's liver transplant, and how this could potentially change his condition?
I would have to say, because of just everything that I've watched my son go through for the last 17 months of his life. It has been very traumatizing. I have what they call medical post-traumatic stress disorder,
Mm-hmm.
which I didn't think was a thing, but it's a thing. And just watching him go through everything he's went through, and knowing what kind of life right now that he is leading with, well, your sisters can have this, but you can't. Your sister can have a cheeseburger from McDonald's, but you can't. Your sister can have chicken nuggets, but you can't have them. I don't. It's not fair. On top of, with everything he's already been through, I don't want to add to it, I guess, is kind of what I'm trying to say. But also, every time he gets sick, run to the hospital. His amino acids are high. We're in the hospital getting TP and the lipids. And with both diseases he has, we have that problem. And mind you, even with the transplant, he would have that problem. Every time he got a fever, he would have to go to the hospital, because he's a recipient, a transplant recipient. So he would always have to do that anyway. So I'm, thinking about that. It's like, okay, well, I mean, if we're going to have to do the same thing as far as, hospital stays go, regardless if he has this surgery or he doesn't, except the difference being he's better off with it and worse off without it. I'd rather, I'd rather give my son the surgery to change his life, to make him happier, to make him have a better quality of life. you
Yeah.
know, because at the end of the day, we're not really changing much other than he won't be on a special diet and won't have to take all these medications. Other than that, we're really not changing anything medically anyway.
Yeah.
We're not
You
really changing
for
a
another.
whole lot
Yeah.
because we're still running the hospital. You're sick, we're at the hospital. Lord knows how long we're going to be here. Have to get the PICC line because we need TP and the lipids. Gonna need that regardless of what hits the fan, whether you have a transplant or you don't.
Mm.
So the major thing we're changing by doing the surgery is we're altering his life in a way that will make his quality of life go up.
Mm-hmm.
It will give him a better quality of life, and that was enough for me because I am just really over watching my son be miserable.
Yeah.
It's not fair and it's not right to watch children live that way or anybody, but children at the top of the list. 'Cause it's like, hey, you're a child. You haven't even experienced life yet. You should be miserable from the door. You know what I
Mm-hmm.
mean? It's just not. It's just not something that I want to watch the next 10 or 15 years or however long
Right.
it goes on. So yeah, I opted for transplant. Of course, his motility doctor was like, "Oh, well, the risk is too high." Yeah, well, it may be in your opinion, but you're not a transplant doctor, so at the end of the day, I'm gonna need you to refer me to somebody that is, because And then I went and seen Dr. Kathleen Campbell in Cincinnati. I think that was the 16th. We just went there on the 16th, and right off the rip, she wanted to do the liver transplant because hey, it'll cure him of his MSUD because he doesn't carry the gene. So that was enough for her as far as that went. And then she wanted to get us in connection with the intestinal transplant doctor because she wanted to do a double, so he would get both done at once, which would probably require him to be in the hospital a little longer
Mm-hmm.
after the fact than most. He would have to still come home on the PICC line with the TPN and the fluids for a year. He wouldn't even be able to use his J tube for a year because everything down there would have to heal really well. Make sure it does what it's supposed to do before they would probably push to that option. Uh, so yeah, I picked the surgery because hey, if my son's going to be put through all this crap anyway, and you're going to poke and prod him, and you're going to do this and do that and you might as well make it worth it at the end of the day. Okay, you want to put my son through a surgery? He's had 8 of them. He's had 8 of them since April. If you want to put my son through a surgery, put him through one that will prevent him from ever having to have another one. 70% chance of him never having to have another one. Is that's what we're going to do? Let's do the one that matters. Let's do the one that counts. You
Yeah.
know what I mean? So, and some of them were petty. Some of the surgeries were petty. They weren't even. I don't even know if I really consider them a surgery. I mean, he was put to sleep, so maybe it was. I don't know, but it's been a lot. It's been a journey. He's had a lot done in the last 6 months. He's had a lot done.
Yeah. Your son's preparing for a liver transplant, liver and intestine transplant. Can you share with us your what led to? Oh, we already went through that. Okay. Let's see. How are you preparing for the recovery process, and what kind of support do you expect to need during during and after the transplant surgeries?
Well, at the moment, I'm not really. The only preparing I'm really doing is getting in conversation with all the teams. Of course, he has to see for his initial evaluation.
Mm-hmm.
Because he'll have to go, through the genetics and neurology and motility, GI. Pretty much every specialist they have for any body part that you have, he's got to, he has to see them. And so I'm not really preparing mentally yet for the process of going through surgery. After the fact, the recovery process with Junior, which I know is going to be a challenge, given everything that's going on, or that will be going on anyway. Uh, I'm trying to kind of wait for that for when we do see all the specialists and start the process of hey, this is what we need to look at to make sure he's good to go. Like surgery is safe for him, in other words, which is fine. So I'm just kind of waiting until then to really, I guess, let it set in that, hey, this is something that we need to mentally and emotionally prepare for, because it's going to be hard. And I already know it is. I can just, picture it in the future, how hard that's going to be, to especially seeing my son like that. But hey, it's all for the greater good, in my opinion. And as far as the aftercare support, right now he has an in-home nurse that we see once a week. So I'm assuming that she will be in charge of his at-home after surgery care, because again, he'll have the PICC line. There'll have to be somebody here qualified to deal with that, because I'm not, and honestly wouldn't want to be. How as risky as those are, I would not want to be qualified to deal with them whatsoever. So I'm assuming she'll be the one taking over his care when he comes home. And then we are looking into seeing if we can have like a night nurse or a day nurse, while he is home with his PICC line, either when he gets it the beginning of October, or because I don't know if he'll have it by the time surgery rolls around. I don't know if it'll still be in it. It probably will be, but I'm not sure. Or when he comes home from surgery. So we're going to look into getting him a day nurse or a night nurse, because there's a lot of risks that comes with that PICC line. And I don't know if anybody really knows anything about PICC lines, but they go directly into a large vein that is into your heart, pretty much, or next to it. But it's in your bloodstream. And the smallest particle of dirt or germ or anything can cause a very severe infection that can kill somebody. As it can cause them to go septic very quickly, in a matter of an hour, sometimes less, depending on how long it's been there, or what kind of germ it is, or what kind of whatever got in it. So to even change those out, because they have to be changed once a day. So they even change them out, it has to be you have to be in a sterile environment, like alcohol, gown on, mask on, hairnet on. Nobody that has a mask on is allowed to be around, because even breathing on that, you can get spit or saliva or any kind of thing on that line, and it could be the end for somebody incredibly quickly. And it's a very scary thing to have and to have to deal with. Junior had it for about 3 months, or almost 3 months, while we were in the hospital, from April to June. And he pulled it apart a couple of times. He had it twisted. I mean, it's a very risky thing to have, and if you can avoid it, I would. I would definitely recommend to avoid that as long as you could, if at all, because it's a scary thing to have, especially when you have to bring the kid home, a young kid or an adult home with it, because now you don't have a medical professional around you all the time that can deal with it. It's up to you, and anything at any time could hit the fan. So yeah, that's not something that I would advocate for. Unfortunately, my son doesn't have a choice but to get one, but that's not something I would advocate for at all. Like, if you could push it to where you can prevent getting one, that's great. So it's a lot of things that I'm nervous about as far as this aftercare. Is that the fact you'll have 2 ostomy bags instead of 1. Is a little overwhelming, because it's like, well, it's hard enough to manage the 1, much less 2. So that's a little overwhelming. And then yeah, so as far as aftercare goes, there's a lot of things that seem very overwhelming that I'm just trying to not really think about at the moment, because I don't, I'm not required to at the moment.
Yeah.
But I probably need to be honest with you, because the sooner I do, the sooner I get over it, the sooner I can do certain things. But with certain things, I'm a procrastinator. So,
Yeah. What has the medical team told you about the benefits and risks of the liver and intestine transplants, and your family preparing for the possibility of your son being cured of maple syrup urine disease?
Well, as far as the transplant lady we seen, so Dr. Campbell,
Mm.
that we saw in Cincinnati, she was very optimistic. Now, she did tell me that there are cases that she's had where children have gotten a intestinal transplant that came out worse than they were before they went in. But she did say that that was rare, and also depends on the child or person, teenager, getting the transplant. Also depends on all the other medical things they have going on. Did we do everything that could have been done? I guess while in surgery or with everything else, did we have this under control? Do we have that under control? But the plus side to Junior having the double transplant, so his small intestine and his liver, actually is more beneficial than if he was to get one or the other. Because the liver protects the small intestine in a sense. It's like a safety net, because it gives, I guess, some, I don't know, stability, and it's less likely for your body to be like, oh, well, hey, you don't belong here. Let's try to push you out, which goes to the rejection of the organs. It goes best with both of those together, because that risk you have for rejection goes to about 40% at that time. Now it's happened. It still happened. But the chances are lower than they would be if you just did one or the other. Especially with the liver, because if you just take the liver out, most kids have about a 60% chance of rejection, because you're adding that into two organs that work simultaneously together with it. So you're adding it to them, and they don't match. The genes don't match, the DNA don't match, the blood don't match, the this don't match, and so it's more likely with a singular transplant to have bigger problems, to have for it to be more risky, than doing them both together. And as far as looking forward to him not having the MSUD, I'm actually really excited about it, because I'm really excited to watch him explore foods, and be able to have birthday cake, because he couldn't have one on his birthday. So it's like, I'm looking forward to that, and seeing just all his first experiences, with a lot, just everything he's missed out on in 2 years. Like, it makes me emotional, because it's like, it's one thing when you have a baby and they grow to that stage and then you watch them do it, but it's another thing to have a baby, watch them grow, and they can't do it, and then something changes, and then they're able to do these things, and just to see how they react, to all this, because they're like, what is this? You know what I mean? Like little kids, and they're like, oh, what is this? And so I look forward to it.
Yeah.
I look forward to watching Junior be able to explore all these different things after surgery.
So let's see. Moving on here. September is Newborn Screening Awareness Month. And he wasn't diagnosed through newborn screening, but how important do you think it is for conditions like MSUD to be part of the newborn screening panel?
Say that again.
How important do you think it is for conditions like maple syrup urine disease to be part of the newborn screening panel?
Oh, very, very. I think that it is very important, because without that, and certain other things, it puts more kids at risk of coma or dying, and nobody knowing why, because we didn't do the newborn screen, or you have kids like Junior that get left untreated for so long, but are lucky, that they didn't have these metabolic crises. There are kids that are lucky, there are kids that aren't. And, with his situation, and the only thing that really saved my son from a metabolic crisis was the fact that he was on a tube feed, was the fact that he threw up, was the fact that he had the pseudo obstruction. Because without any of that, if everything else worked accordingly, and he was, he was brought up normal like any other normal infant to toddler to small child, he would have been close to death, if not dead at this point, because it was left untreated. Nobody knew, nobody cared, nobody, you know what I mean? And that goes back to my advocating. That goes back to my
Yeah.
advocating thing. That is such a big part of all of this. That is such a big part, especially of these rare diseases that people don't know anything about. And I'm only 6 months into knowing about these things. I had never heard of maple syrup urine disease. I had never heard of the pseudo bowel obstruction. Advocating is what is needed. More people need to know about these things. Because who knows how many kids or infants have passed away in times past that they're like, oh well, they died of SIDS, but could have been maple syrup urine disease, but you don't know because
Yeah.
either A, you didn't do the newborn screen, or B, it just nobody thought about it because it's so rare and nobody talks about it. There's really no information out there. You have genetic doctors that are still trying to figure it out, that are supposed to be experts in this kind of thing. You know, so yeah, I think that it is very important. That is very important. And I also think that even with the newborn screen, I think they should be tested 2 or 3 times. Like newborn screen, when they go to their 1 week checkup after being born, do it again. I think it ought to be done at least 2 to 3 times after birth to
Yeah.
know for a fact that, hey, this is not a problem. Because if there's anything I've learned about maple syrup urine disease and having a son that has it, things can change at the drop of a hat. His numbers can be normal one day. The next day they test it, they're sky high. The next day they test it, they're really low. The next day they look at it, they're normal. Maple syrup urine disease is not something that is the same. It is never the same. It always changes. It's always changing, and it can change with the smallest of anything. The smallest alteration to the metabolic formula, the smallest alteration to the thiamine they're taking, or to the diet they're on, or the labs they're doing. Just smallest of things can trigger these amino acids. There are medications out here that trigger these amino acids. And so it's something that I believe needs to be tested more than just newborn screen. You need to test them once a month at least for the first probably 6 months of their life, just to be 110% sure that, hey, this is not a thing. You know, because just because it says no once doesn't mean it's going to be no tomorrow. It doesn't mean he's not going to have it tomorrow. You know.
Right. There's false positive, false negatives of quite
Yeah,
a lot.
exactly. So I believe that is really important, and I believe it needs to be tested more than just then.
Yeah.
That needs to be a thing. It needs to be all the time. Like for the first 6 months of a baby's life, they should be tested once a month. Period. That's the way I look at this, because I've learned so much with my son in a short amount of time. Things change so fast, and it could either be a bad thing or it could be a good thing, and you don't want the bad part. Because I've watched it. My son almost put himself into a coma while we were in the hospital because his amino acids were so high. So, yeah, that is something that needs to be a thing, but more than once. We need to repeatedly test these babies for an extended period after birth, just so we know for a fact. Okay, you're 6 months old. We've never had a high amino acid. You don't have a maple syrup urine disease. Uh, but that's just my opinion. But yeah, I think that's a very
Maple
big
syrup
thing.
urine disease is one of the most critical of it too, because it's branched chain amino acids and not just one amino acid.
Yeah.
That there is a problem with, and so there's multiples. Let's see. The Medical Nutrition Equity Act could provide important coverage for medically necessary foods, formula, and vitamins nationwide for conditions like MSUD and chronic intestinal pseudo obstruction. how would this legislation impact your family's life?
Well, it would be very helpful.
Mhm.
Given that my son at the time requires these things, but it shouldn't be hard for anybody, to be able
Yep.
to get things that medically help them. Like, you should have to fight somebody,
Mhm.
to get the things you require for your medical conditions.
Mhm.
That should be given. Like, hey, you got this maple syrup urine disease. Okay, well, you need metabolic formula, you need thiamine, you need this multivitamin, or you need this, or you need that. Yeah, you shouldn't have to. It shouldn't be an argument. That should be something that is required by law to be given. In my opinion.
So that's what we're aiming for, but it's been a good 20 years in the fight
Oh yeah.
because of a lot of misnomers around it. But they think that the foods are available in the stores and they're not. And can't you just get anything off the shelves in the stores? Well, protein
Yeah.
tolerant.
Yeah, pretty much. And that's sad. Like,
People think formulas are only for babies, and not true.
they're not. Yeah, I have a friend that's got some issues where she had to be on baby food for a long time.
Yep. The formula
So,
is a lifelong thing for us. Um, and the vitamins are are also listed as a medical food, and so that's why we have a problem with vitamins. And so they can be found in foods, but they're in foods that we can't have.
yeah,
So,
yeah, pretty much.
um, how can listeners get involved in supporting the Medical Nutrition Equity Act and advocating for rare diseases, family members?
Um, Talk about it. I mean, and I know that sounds so simple, to a lot of people, but it's not gonna the knowledge from people with maple syrup urine disease, or any other rare disease. It's the knowledge of it isn't going to change if people don't talk about it. People don't make it a conversation. If they with their friends or their family or their support group or their doctors or their hospital, or if it's not talked about, it's going to get nowhere. The lack of knowledge is going to remain the same.
Mm-hmm.
Um, so that's just what people need to do. They need to talk about it, talk about it, and talk about it, and talk about it. And at some point, people are going to get it. They're going to be like, hey, these are important. Because people look at certain things as being, uh, what's a good word to use? Less than other things.
Mm-hmm.
Like, pseudo obstruction is less than diabetes. Diabetes is less than cancer. You know what I mean? People look at these things like that, and that is not the way to look at it, because any medical condition matters. It is
Mm-hmm.
important that the people that not only are working in the field to have the knowledge of these diseases, but it is important for them to know, hey, this is what is required. This is the testing that's required. This is the medications that are required. This is the food that's required. It's important for these people to know, because this questioning back and forth, well, do you have it or do you not, put so many people's lives at risk. Whether it's kids, teenagers, adults, or whoever. That, oh, you have it today, you don't tomorrow. So you need to talk about it. People need to talk about it. People need to advocate. They need to, even if they don't know much about it, do what I did. Get the little bit of research on Google that there is to get. And then sit down and call your children's hospital. Talk to your metabolic team, or something, because sitting and doing nothing isn't going to change anything. That's like beating a dead horse and thinking it's going to get up at some point. You can't, it's just things you can't do. You just got to talk about it. People have to bring more awareness to these type of things, because none of them are less than the other. None of them are more important than the other. But I bet they know more, people know more about these common things than they do the rare things, which makes sense given that they're rare. But you would think people would want to know more about these rare things. So when they come across these rare things, they're like, oh, well, hey, I know what that is. It's blah, blah, blah. We don't have to have a 3-month discussion about whether you think this is maple syrup urine disease or you think this is pediatric intestinal pseudo obstruction. We don't have to have a 3-month conversation about it because you already know. Because you've done what it takes to know that. You've talked about it, you've researched it, you've done this, you've done that. Not saying people don't do it, but there's not enough people doing it. That's the problem.
Yeah, that's the
There's
reason.
not enough people doing it.
That's one of the reasons why I'm doing the podcast.
Yeah, it needs to be talked about. It's important.
Yeah. So,
I'll talk about it all day long. I'm blue in the face. Mommy. It needs to be talked about.
is to contact your senators because we are looking for a Senate Republican to reintroduce the bill.
Oh, well, I got a real good one. Jim Jordan, man, great guy.
Yeah, if he is willing.
Yep, great guy.
Mommy, can we get a snack?
And every life.
Go away for a minute.
In February, Rare Disease Week, they have a something where you get together on Capitol Hill, talk to your House and Senate Republicans. Your both the Republican, Democrat, but both your Senate and your House representatives. So
that's a good opportunity. All these people stand in front of the Capitol and Congress and the Senate and all this other crap for stupid things. It's like, hey, why don't y'all make a sign and go stand out there with a sign that says, hey, maple syrup urine disease on it, or hey, this rare cancer, or hey, this. Why don't y'all go do that crap for the stuff that matters instead of, oh, you hurt my feelings yesterday.
Yeah.
There's more important things to talk about. These things are important. Our kids are important. The adults that are living with it, that struggle with it, they're important. All these things are important.
Mm-hmm.
These are things we need to be rallying to do. These are the things we need to be doing. Rallies and standing for the Senate. Hey, we need to do something about this. These are the things that are important.
Mm-hmm. So being a caregiver can be incredibly stressful. How do you have how do you care for your own mental health and mental and emotional health while supporting your son?
I really don't, which is a problem, because I'm just so worried about him, and I'm so worried about dealing with the things that he's going through and making that my priority, that I kind of push myself to the side, which, given, I had many mental breakdowns while we were in the hospital this past April, and it was very traumatizing, honestly. But anymore, I just, I take a step back, because I have to, not because of, I want to neglect my son, or I want to be this way or that way. But sometimes I have to take a step back. I have to separate myself from the situation, to do, the self-care, as far as, the mental and emotional, the physical, because a lot of people, they don't look at it as being a physical thing, but it is, because you're constantly doing something. And he's up most nights, crying. So, there's a lack of sleep that's there. So yeah, so anymore, I step back from it. And I just take some time for myself, whether that's, going out with a friend, or just ignoring the existence, and making my husband deal with it, for a short period of time, because I got to the point where I couldn't handle it. I couldn't handle the mental, the emotional, and just having to deal with him around the clock. I got to a point where I started feeling like I hated my kid. And I know that sounds really bad. but I felt myself getting that way because it's like, crap, if I didn't have you, I would have to deal with all this. But at the end of the day, I had to remind myself, hey, it's not his fault. It's not my fault. It's not his fault. It's just the way it is. Being mad at him is not going to change any of it. And it wasn't really that I was really mad at him. It was just I just put myself through too much. I ran myself through the ringer without giving myself a break, and I just had to, like I said, I just had to step back, and take a breath and recoup, in a sense, I guess you could say. And it was hard because the guilt you feel, from doing it is massive. At least for me, it was anyway. Because I was what he was used to. So, being left with somebody else, it's not his cup of tea, but it's like, hey, I love you, buddy, but I need to take a breath. I need to give my other kids some attention. I feel guilty about that. But it's been a journey. But so as far as my self-care, I take a step back and watch a movie. I sleep, take a shower, disappear for just for a period of time.
Let's see what resources or support networks have been most helpful for you throughout throughout this journey?
I'm gonna be real with you. I haven't really had a support system like that. I haven't really had resources like that. I mean, that's just something that we don't have.
Mm-hmm.
Unfortunately. So it pretty much just falls on me for the most part. Yeah, because we don't really have the support for it. Because we don't really have family like that.
Mm-hmm.
So we just manage on our own, and some days we're easier or harder than others. But at the end of the day, we get through it.
So there, like the Facebook group or that you have that.
Oh well, yeah. I mean that. Yeah, and Sandy, I think is her name that runs the group.
Susan.
Sandy, real nice lady.
Oh. So
I had the opportunity to talk with her, over the phone.
Mm-hmm.
Shortly after we, found out about the Maple Syrup Urine Disease, and she told me a little bit about her son. So yeah, she is great help. When I have questions or concerns about certain things, she's been good help. There are some people in the group that have been helpful, with some other things. You'll get some advice, as far as the transplants go, or what they did as far as, diet and stuff like that. How their kids are doing that either after surgery or if they would recommend surgery. I do ask those questions, hey, if you had the option, would you do it? Would you not? Why not? So, a lot of people in the group have been helpful. I didn't even really consider that, just kind of crappy. But yeah, I mean, apart from that and stuff, it's we just go day by day.
Have you been to any of the symposiums?
No, because when I think they had one back in May. I was still in the hospital with Junior, and I know they do live ones here and there, but I just, with everything I have going on, I haven't had time to
Mm-hmm.
make the time to do it yet. But I do actually plan on doing one of those. I do
Yeah.
plan on doing one of those. I'm sure it'll be very
Needleman does
informal.
happy hour also. They were but she does them on like a Zoom meetings. But
Well, that'd be nice.
What lastly, what message would you like to share with other with other parents and families who are just starting out with on this rare disease journey?
My advice to them would be, back to my advocate for your child. Because at the end of the day, yeah, the genetics people probably know a little bit more than you. But again, nobody knows your child better than you. If something doesn't feel right, it's probably not. You have a gut feeling about something, listen to it. I do not recommend whatsoever of ignoring it. I made that mistake. If you're not okay with something, you're not comfortable with something doesn't make sense, speak on it. Because nobody knows if you're confused or you're on the same page if you don't tell them. Don't let doctors scare you with the big terminology or the whatever they want to use to be like, oh, hey, if we don't do this, right now, then this is going to happen. And mind you, sometimes that might be the case, but don't let them scare you into speaking up for your child. That's just not something that you want to do. Advocating. I cannot say that enough. Advocate. Listen to your mommy gut. Listen to your instincts. Listen to something ain't right. It's probably not. But that's the best advice I can give somebody going through this journey right now. Is advocate really hard, and because your kid's all you are all your kid has. At the end of the day, them doctors ain't gonna be there. The hospital ain't gonna be there. The psychology lady in the hospital ain't gonna be there. At the end of the day, it's you and your child. You are it. You are their support team. You are their main team. Okay, avocation. I cannot say that more.
Mm-hmm. Let's see. Thank you so much for joining us today.
Oh, thanks, Tommy, for something about a Trump 24. All right, sweet.
So, reconnection. I want to remind everyone that if you are someone is struggling, and you're not alone. Please, available 24/7. Suicide Prevention Lifeline at 988, or text hello to 741-741 for support. If you enjoyed this podcast, or if you enjoyed this episode, please consider subscribing to my YouTube channel, Rare Chef, where I share cooking videos as well as the live version of this podcast. If you're listening on an audio platform, don't forget to subscribe there. Subscribe to the podcast there as well. For more updates and resources, visit my website, rareconnection.org, and be sure to check out the Rare Connection Facebook page and Facebook group to join our community. I'm also in the process of turning Rare Connection into a profit, which I plan to file for the 501c3 status on or for board meeting on October 2nd. If you have questions or would like to reach out, you can also text me via the link in the show notes if you're listening to the audio version, or just comment below if you're watching the live version. And for watching the live version, feel free to drop your comments below. Thanks again for being part of our Rare community. Stay connected, stay informed, and we'll see you again next time.